We have two offices. My main practice, I started out in 1980. I graduated in '84. I grew up in the city. And I came out to Long Island in 1986. And I opened up our first facility, which has, since 1986, that practice has grown by 200 to 150 to 200 patients a month. An absolute unbelievable influx of, which is a testament to the way we do things in general. I had opened up several other practices that I've, in different areas of Long Island that I've sold, but I maintained the larger practice that I first opened. And then later on, just recently, I opened up my little private practice in my community, where it's a little bit more personal and a little bit more, as I said, I have 5 children and they're all in the community, and I coach football and I coach baseball, and everybody knows who I am, and I want to be there and I want to help and give back. And that's my little private facility. But both facilities are high-end, and they all have that philosophy of patient care, and they all have constantly benefited by my reinvestment back into the facilities and the practices. And the growth of the practices speaks for itself, and I'm very proud of both of them. Yeah, the larger office was basically an insurance practice from the get-go, although it's now 50% insurance and 50% private. My Fox Dental practice is mainly is more private than it is insurance. Capability-wise, the larger office employs all the specialties. I'll have a root canal specialist there, and we'll have an oral surgeon there, and we have an orthodontist there, and we have a periodontist there, and we have 6 hygienists there. So if you need specialty care, there is a specialist to treat every one of the needs in that particular practice. In my private practice, I'm the only dentist. I do everything. If it's a little too advanced, I have one of my specialists in my other location take care of it. But for the most part, in my private practice, I do 98% of everything that comes in there. The larger practice is not only myself, so it's a little less me, a lot less me, and more of a diverse and different practicing group of doctors. And in my private practice, it's more of a congenial and a more personal situation, because it's just myself and my wife.